In this section, we will talk about the small bones present in front of the femur called the patella. The patella or patellar bone is the largest sesamoid bone in the body. Sesamoid bone means a bone that is embedded in a tendon or muscle. Patella is embedded in the tendon of the quadriceps femoris that is present anterior to distal femoral condyles. It is situated in front of the lower end of the femur about 1 centimeter above the knee joint. As for the bony features of the patellar bone, the patella has an apex and a base as shown here. It also has 3 borders, superior, lateral, and medial, and 2 surfaces, anterior and posterior. The apex is directed downwards. It is rough and vertically ridged. It is covered by an expansion from the tendon of the rectus femoris and is separated from the skin by the prepatellar bursa. Coming to borders that are 3 in number: medial border, lateral border, and superior border. Medial and lateral borders are comparatively thin. The base makes the superior border, which is quite rough, thick, and inclined downward and forward. These borders are the attachment sites of the quadriceps femoris. Remember medial from M moving towards the body and lateral from L, leaving the body. Talking about the surfaces there are: anterior and posterior surface. The anterior surface is the one facing outwards, making the curve of the knee. It is convex and perforated. These perforations are for the passage of nutrient vessels. Stria are the markings of these vessels. The surface is completely covered with quadriceps femoris. Bursa is present between the integument and the patella on the anterior surface. It is a sac filled with synovial fluid and acts as a cushion to provide protection against injuries. The posterior surface is covered by the articular cartilage that is 4 to 5 millimeters thick. The posterior surface is articular in its upper 3/4 and non-articular in its lower 1/4. The articular area is divided by a vertical ridge, called the patellar ridge, into a larger lateral and smaller medial portion. The medial and lateral facets are 2 large shallow depressions that give articulation to condyles of the femur to form a patellofemoral joint. During various phases of movements of the knee, different portions of the patella articulate with the femur. The lateral articular facet is large and articulate with the lateral condyle of the femur. The medial articular facet is comparatively small and articulate with the medial condyle of the femur. There is a 3rd odd facet present on the posterior surface. It is basically the medial portion of the medial facet that lacks articular cartilage. It articulates with the lateral border of the medial femoral condyle. Now that you are familiar with the features of the patellar bone, you should be able to determine the side of the bone easily. The patella is triangular with its apex directed downwards. The apex is non-articular posteriorly. The anterior surface is rough and non-articular. The upper 3/4 of the posterior surface is smooth and articular. The posterior articular surface is divided by a vertical ridge into a larger lateral and a smaller medial area. The bone laid on a table rests on the broad lateral articular area. Knowing these points, it is easier to determine the side of the bone. So you can deduce the anatomical position of the patella is that the anterior rough surface is put anteriorly with its apex pointing downwards. The posterior articular area is put posteriorly. Now let's talk about the attachments of the patellar bone. The superior border or base provides insertion to the rectus femoris in front and to the vastus intermedius behind. The lateral border provides insertion to vastus lateralis in its upper 1/3 or half. The medial border provides insertion to the vastus medialis in its upper two-thirds. Patella also serves as an attachment site for ligaments, such as the medial and lateral patellar retinaculum. The non-particular area on the posterior surface provides attachment to the ligamentum patella below and is related to the infrapatellar pad of fat above. Thus, the quadriceps femoris muscle is inserted into the patella, from where ligamentum patellae arise, which ends in the tibial tuberosity. That is all about the sesamoid bone of the lower limb.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.